and they denied us. And he never got the chance, and what started out as kidney cancer spread to his brain, his liver, his lungs, adrenal gland, lymph node, renal cavity, and the day on my birthday, January 13th of last year, we were at KU all morning getting blood because he was confused. And I didn't know that he was going to come home that day and go slip into a coma, because I walked him through the front door. We talked with Jim Flint that day, and an hour later he went to sleep. And still to this day, no one is being held accountable, and no one has conscience about it. And what I do from then here on, or anything else I do, is not going to bring my husband back. But I don't want it to happen to anyone else. And if my husband's story can help someone else, then his death wasn't in vain. And I have a son that has a 50% chance of having the same gene. And my insurance denied getting tested for the gene. But then you look at it and think, well, if I get him tested and it comes back positive, I know he's not going to get the care. So it's kind of a, win-lose situation. And if he has the gene, he'll get it 10 years earlier than what my husband did. So that would make him 25. And he's 15 now. And, nobody knew that I was going to be in Michael Moore's movie. He contacted me. I didn't go looking for him. I didn't submit my story on his website. He found me. And I'm not going to turn it down, But a lot of people don't understand. I still work at the hospital. I work the minimum hours that I can. But I want them to look at me, and if they want to get rid of me that bad, then they're going to fire me. But I want them to know that I'm not going anywhere, and I'm not stopping what I'm doing.
These three women are incredibly strong. It's a difficult thing for them to come up and talk about their experience. And I really want to thank them. They're tough. If I'm ever in a bar fight, I don't want these three women to be on. On September 28th in Washington, D.C., Julie Pierce, and I think Tracy Jr. will be there, will be holding a candlelight vigil for her husband Tracy, along with the American Patients for Universal Health Care and Healthcare Not Warfare March, and that's September 28th. If you need more information, you can contact me, and I can get that to you. Blair Thediger is going to tell us a little bit about what's to follow here. I wanted to say one other thing. There is going to be a public forum on healthcare, Medicaid reform, and Missouri HealthNet. Our representatives from the Missouri side, Representative Beth Lowe, Senators Jolie Justice, Minority Leader Paul Lavoda, and Representative Mike Tallboy will be at the Writers' Place on August 28th at 6 p.m. And if you want more information about that, contact me or anybody else. Again, thank you very much, and let's thank these very strong.
My name is Alice Fishon. I'm a member of MAFW and an active social worker. There's one more person I want you to meet, and that's Dr. Keith Ashcraft. And you'll stand up, Dr. Ashcraft. He is a retired pediatric surgeon, nationally known in this country, and he is a member of the National Physicians for a Single Payer Plan. Would you like to make a few comments? We're really proud of you.
Well, I think this is the most important thing that's facing our country, except getting rid of George Bush. And, but I belong to the Physicians for a National Health Program, PNHP, and you can look that up on the internet. It's well worth investigating. I do think that the references to free health care is wrong in this movie, because it isn't free. You have to pay for it. It's got to be universal, and if it is universal, it's going to be beneficial to everybody. So I applaud what you're doing, and keep it up. This is a big deal. We got to get universal health care.
As Brian said, my name is Blair Thettinger. I'm a medical student at KU Medical Center, and I'm here representing Heartland Healthcare for All, the organization that, along with Missouri Association for Social Welfare, brought this event together tonight. What I'm here wanting to do is tell you that there is something we can do in Kansas City. We have an organization that we're trying to build, and Duke Pierce is an organization too that we're hopefully going to meld, work together. And we're working with national organizations like Healthcare Now and Physicians for a National Healthcare Program, trying to advance the agenda and fight for a single-payer universal health plan for all people in the United States. We're also focusing on local issues, things like the state child health insurance programs and Missouri Medicaid cuts and things like that, and trying to support our safety net clinics. The one thing I wanted to add too, Michael Moore chose to focus on people with insurance who were denied coverage. There's another element, is that people that over 45 million people in this country lack health insurance in the first place, and that the Institute of Health now estimates that 18,000 people die every year in this country simply for a lack of having health insurance. And as a student who works at a free clinic, I see these people all the time. I've seen people who I know are on their way toward dying an unnecessary death because they lack health insurance, they lack access to basic primary medical attention. From here, we have sign-up sheets in the lobby. We also have some literature, if you go out to the lobby and to your left, that we're handing out. And we have some small flyers with our information and our website on it. I encourage everybody to get your name on a sign-up sheet, get a little handout that has our website on it, and just check out when the next meeting is and how you can get involved, because we can really make a big difference on this issue. Thanks so much, everybody, for coming tonight. We really appreciate it. Great turnout.
This is the very last thing I want to say. This is Rob Allen with CCO. They're going to have another showing next Thursday. So if you know people that couldn't make it, maybe you can make it then. Go ahead.
I'm going to send a flyer for CCO's event to Brian, and he can send it out so that if you know folks that CCO stands for Kansas City Communities Creating Opportunities. Used to be Kansas City Church Community Organization. Some of you may have heard of us. But we're going to send Brian the flyer. He can send it out. So if you folks